You lose a tooth. Maybe it's a wisdom tooth that's been bothering you for months, or a molar that finally gave out after years of neglect, or a front tooth knocked out in an accident. Within hours, you're managing the situation. Ice pack, pain medication, a call to the dentist, and the knowledge that one way or another, there is a solution. An implant. A bridge. A partial denture. The gap in your mouth is temporary, or at least manageable, and the pain has a clear endpoint. Now, place that same gap, that same raw socket, in the mouth of someone who lived 30,000 years ago. No dentist, no implant, no bridge, no partial denture, no anesthetic beyond whatever plants grow nearby, and no clear understanding of why the tooth came out, whether more will follow, or what the loss means for your ability to eat, to speak, to maintain your appearance in a social group where your face is how people know you. What happened when ancient humans lost a tooth? The question seems almost trivial: teeth fall out, people managed, end of story. But the answer is far more interesting than that. Because tooth loss in the ancient world was not the minor inconvenience it can be today. It was a genuine threat to survival, a marker of aging and status, a social and psychological event with real consequences. And the ways early humans responded to it tell us something remarkable about human ingenuity, human resilience, and the surprising sophistication of ancient approaches to what we now call dentistry. Let's get into it. First, let's understand what tooth loss actually meant for an early human, because the stakes were higher than most people realize. Teeth are not just cosmetic. They are tools, the primary mechanical processing tools of the human body. They break down food into pieces small enough to swallow and digest. Without functioning teeth, or with significantly reduced dental capacity, the range of foods that can be eaten effectively is dramatically reduced. Tough meat, hard seeds and nuts, raw fibrous vegetables. Many of the calorie-dense foods that hunter-gatherers depended on, all of these become difficult or impossible without the ability to chew properly. Researcher Clark Spencer Larson at Ohio State University, who has spent decades studying the dental health of ancient populations from skeletal remains, has documented how dramatically tooth loss affected the ability of ancient people to process food. Individuals with significant tooth loss showed changes in facial muscle development and in bone remodeling of the jaw that are consistent with dietary adaptation, a shift towards softer, less mechanically demanding foods. They ate differently because they had to. And in an environment where caloric density mattered enormously, eating differently often meant eating less effectively. There is also the issue of pain. A tooth that is lost through decay, which means it went through the process of cavity formation, nerve exposure, abscess development, and eventual failure, is a tooth whose departure was preceded by significant and potentially extended pain. We've discussed ancient dental pain in another video, and the picture is not gentle. Tooth loss was often the endpoint of an already painful process, not a sudden neutral event. So, how common was tooth loss in ancient populations? More common than you might expect, and the causes reveal something important about the relationship between diet, lifestyle, and dental health across human history. As we've discussed in other contexts, the agricultural revolution was catastrophic for human dental health. Hunter-gatherer populations, eating diets without refined sugar or processed grain, had dramatically lower rates of cavities than post-agricultural populations. But they had their own forms of dental wear. Grit in food from stone-ground plant foods, from sand and soil contaminating gathered foods, from using teeth as tools caused significant attrition, the gradual wearing down of tooth surfaces. Archaeological analysis of hunter-gatherer teeth consistently shows heavy wear patterns that would be essentially unprecedented in modern populations eating modern diets. This wear, over time, could expose the inner layers of the tooth to the oral environment, leading to sensitivity and eventually to structural failure. Teeth that wore down to the point where the pulp was exposed would become infected, abscess, and eventually be lost. And in populations where heavy dental wear was universal and began early in life, significant tooth loss by middle age was not unusual. Researcher Alan Cooper's work on ancient oral microbiome, which we've referenced before, showed that the shift in oral bacteria that accompanied the agricultural revolution dramatically increased cavity rates. Post-agricultural populations lost teeth primarily to cavities. Pre-agricultural populations lost teeth primarily to wear, trauma, and gum disease. Different causes, similar outcomes. When a tooth was lost, whether through decay, wear, trauma, or gum disease, what did early humans actually do? The first response was almost certainly management of the immediate aftermath. A fresh tooth socket is a wound. It bleeds, it hurts, and it is an open entry point for infection. Traditional medicine systems worldwide share approaches to this problem that reflect genuine empirical discovery of what works. Pressure. Biting down on something, plant material, clean cloth in later periods, anything that could be held in the socket reduces bleeding and initiates clot formation. This is the same principle behind the modern instruction to bite on gauze after a tooth extraction. Early humans discovering this through experience were discovering a real physiological principle. Astringent plants. Plants with high tannin content, oak bark, tea leaves, certain berries cause tissue contraction that helps close wounds and reduces bleeding. Traditional medicine systems across cultures use astringent plant materials for dental socket management, and the chemistry supports the practice. Tannins genuinely do what traditional medicine claimed they did. Antiseptic plants. Cloves, garlic, honey, all with genuine antimicrobial properties documented in modern research, appear in traditional dental care traditions worldwide. Packing a fresh socket with crushed garlic or applying honey was not superstition. It was empirical medicine that happened to work. But what about the longer-term consequences of tooth loss? The gap that remained after the socket healed? Here the picture gets genuinely fascinating, because the archaeological and historical record contains evidence of early human responses to tooth loss that go well beyond simple management of the wound. The oldest known dental prosthetics are remarkable. A 2012 study published in the European Journal of Oral Sciences documented an Iron Age tooth discovered in a Celtic burial site in France, dating to around 300 BCE. That showed evidence of having been replaced with an iron pin post and artificial tooth root implanted into the jaw. The fabrication and implantation of a metal post into a human jaw in 300 BCE represents a level of technical sophistication in dental prosthetics that is genuinely surprising. But even older evidence exists. Researchers examining ancient skeletal remains from various Mesoamerican sites have found teeth that were extracted and replaced with shell, stone, or carved bone substitutes, some dating back over 2,000 years. These were not ornamental some show bone integration consistent with successful osseointegration, meaning the jawbone grew around the implanted material and stabilized it. The ancient Mayans, in particular, appear to have had sophisticated dental practices, including the filing and inlaying of teeth with precious stones and the replacement of lost teeth with carved alternatives. The Etruscans, the ancient Italian civilization that preceded Roman dominance, developed dental bridges made from gold wire that held replacement teeth, sometimes human or animal teeth, sometimes carved ivory or bone substitutes in place across gaps left by missing teeth. These Etruscan dental appliances, some of which survive in museum collections today, are remarkably sophisticated pieces of dental work. They required the ability to work gold wire to a fine degree, the knowledge of how to stabilize replacement teeth against natural teeth, and an understanding of how the dental arch functions that is not primitive in any meaningful sense. What about in prehistoric populations? Before metalworking and before the development of these more sophisticated prosthetics? What did hunter-gatherers do about the aesthetic and functional gap left by a missing tooth? Here the evidence is sparser, but it exists. Ethnographic records from traditional cultures worldwide document practices of tooth modification and replacement that appear in contexts where metalworking was not available. Ground plant resins, beeswax compounds, and similar materials were used in some traditional cultures to create simple, temporary fillings or gap fillers. These are not permanent solutions, but they represent the application of available materials to a real, practical, and aesthetic problem. There is also the evidence of what bone and joint analysis can tell us about dietary adaptation to tooth loss. Individuals with missing teeth in archaeological samples often show adaptations consistent with chewing on the opposite side of the mouth, or with dietary shifts towards softer foods. The body adapts. The individual adapts. And in a group context, others adapt too by processing food further before sharing it, by cooking methods that soften food for group members with limited dental function, by the kind of flexible food sharing that is documented in traditional hunter-gatherer groups. Researcher John Lukacs at the University of Oregon has documented the patterns of dental modification and adaptation in ancient populations and found that tooth loss was managed not just individually, but socially, that groups appear to have accommodated the reduced dental function of members through food preparation practices that reduced the mechanical demands on compromised dentitions. There is also the social and symbolic dimension of tooth loss that deserves attention. Because teeth are not just functional, they are one of the most visible markers of age, health, and social status in human faces. A smile missing teeth communicates something. In traditional cultures without modern dentistry, visible tooth loss was understood as a sign of age and, in some contexts, as a marker of social or spiritual status. In some traditional cultures, deliberate tooth extraction or modification was a rite of passage, the loss of specific teeth marking transition from one life stage to another. The practice of tooth avulsion, deliberate extraction of healthy teeth as a cultural or ritual practice, has been documented in ancient populations on multiple continents, appearing in skeletal remains from Africa, Europe, Southeast Asia, and the Americas. This means that tooth loss in the ancient world occupied a complex cultural space. Sometimes it was involuntary, the result of disease, wear, or trauma. Sometimes it was deliberate, a chosen mark of identity or transition. And the cultural meaning of the gap in the smile varied accordingly, from marker of decay and aging to badge of belonging and transformation. Researcher Andrea Cucina at the Universidad Autónoma de Yucatán has studied the dental modification practices of ancient Mesoamerican populations and found extraordinary sophistication in both deliberate modification and prosthetic replacement, evidence of a complex cultural relationship with teeth that went far beyond simple survival considerations. Let me close with something that connects all of this to the larger picture of early human ingenuity. The story of ancient tooth loss is, at its core, a story of problem solving. The problem was real. Tooth loss reduced the ability to eat, caused pain, changed the face, and, in a social species, changed how others perceived and related to the affected individual. The solutions early humans developed, from immediate wound management with empirically effective plants to long-term dietary adaptation to the extraordinary engineering of replacement teeth from metal, shell, stone, and bone, represent exactly the kind of creative, persistent, socially embedded problem-solving that defines human intelligence. The gap in the mouth created a gap in capability. And across every culture and every time period we can examine, humans responded to that gap by trying to fill it with whatever materials were available, with whatever knowledge had been accumulated, with whatever social support the group could provide. The next time you sit in a dentist's chair for an implant or a crown, you are benefiting from a chain of human ingenuity that stretches back thousands of years. The ancient Etruscan goldsmiths who bent gold wire around replacement teeth, the Mayan practitioners who carved shell substitutes that integrated with living bone, the countless unnamed individuals who packed a fresh socket with crushed garlic or chewed oak bark on the side of the mouth where all the teeth still worked. They were all doing the same thing you are doing when you call the dentist. They were refusing to accept the loss as simply the end of the story. That refusal, repeated across every human culture and every period of human history, is how we got from the first lost tooth in the deep past to the remarkably sophisticated dentistry of today. If this one made you feel slightly better about your next dental appointment, you know what to do. I'll see you in the next one. There's one more dimension of this story worth exploring. The relationship between tooth loss and age, and what that relationship tells us about how ancient humans understood the passage of time in human bodies. In the modern world, we have largely separated tooth loss from aging through the infrastructure of preventive dentistry. Regular cleanings, fluoride, early intervention for cavities, these have made it possible for many people to keep their teeth well into old age in ways that were simply impossible for most of human history. For ancient humans, tooth loss was one of the most visible and reliable markers of advancing age. A mouth full of intact functional teeth was a mouth that belonged to a young person. A mouth with significant wear, gaps, and reduced function was a mouth that had lived a long time. The body kept its records in the teeth. This meant that tooth loss was not just a health event, it was a social signal. In a small group where everyone knew everyone and where age and experience carried real social weight, the appearance of tooth loss communicated something about a person's position in the life cycle. An elder with reduced dentition was not simply someone with dental problems. They were someone whose face literally showed their years, whose smile or absence of smile told the story of a long life. Researcher Christopher Ruff at Johns Hopkins University has studied the relationship between dental wear patterns and skeletal markers of aging in ancient populations and found strong correlations that suggest tooth loss was understood, even without modern medical knowledge, as a natural consequence of long life. In cultures where elders were valued for their accumulated knowledge and experience, the visible markers of age, including tooth loss, may have carried some of the same social weight as the experience itself. This doesn't mean tooth loss was welcomed or not grieved. The loss of a tooth, then as now, was a moment of mourning for a functioning part of the self. But its meaning was embedded in a cultural context that understood it as part of the natural arc of a human life, not as a medical failure or a cosmetic problem to be aggressively corrected. And there is something worth saying about the specific experience of losing a front tooth versus a back tooth because the cultural and psychological stakes were different. A missing molar affects chewing. A missing front tooth affects the face. In a species for whom facial recognition and facial expression are fundamental to social life, in a species where the smile is one of the primary tools of social bonding, the loss of a visible front tooth was a different kind of event than the loss of a tooth hidden in the back of the mouth. The archaeological evidence for deliberate replacement of front teeth, the iron pins, the shell substitutes, the carved bone alternatives documented across ancient cultures appears disproportionately in the context of front teeth. People were more motivated to replace what others could see. This is not vanity in any shallow sense. It is the recognition that in a social species, the face is a critical interface with the social world. A face that looks significantly different from the norm creates a social friction that affects relationships, status, and ultimately survival outcomes in group living species. The ancient individual who sought to replace a missing front tooth was not pursuing cosmetic perfection for its own sake. They were managing their interface with their social world in a way that had real, practical consequences. The continuity between that ancient motivation and the modern person who gets a front tooth implant for professional and social reasons is not accidental. It reflects something deep and consistent about the human relationship to the face as social instrument. We have always understood, at some level, that the face is not just ours. It belongs to everyone who looks at it. Let me also address something that doesn't often get discussed in these conversations. What happened in the period between losing a tooth and whatever solution was found, or when no solution was found at all? The honest answer is, people adapted, imperfectly and over time, to a reduced capacity. They shifted their chewing to the side of the mouth with more intact teeth. They avoided foods that were too hard or too chewy. They relied more heavily on cooked foods, which soften under heat. They asked for help from group members with better dental function, sharing food that had been pre-processed by others. And gradually, the absence became normal. The gap stopped being a wound and became simply a feature of the mouth. The dietary limitations became the new dietary pattern. The social adjustment to a changed appearance settled into a new baseline. This kind of adaptation, the gradual normalization of a changed body, the integration of limitation into a new version of normal, is a fundamental human capacity. It appears in every context where the body changes in ways that cannot be fully corrected. And it was operating in early human groups around tooth loss exactly as it operates today in every person who adjusts, gradually and imperfectly, to the reality of a body that does not work the way it once did. That adjustment is not giving up. It is the wisdom of a species that has been dealing with the imperfection of bodies for as long as there have been bodies to deal with. And the combination of that adaptive wisdom with the persistent ingenuity to seek better solutions, to try the gold wire and the shell substitute and the carved bone, is what makes the history of human tooth loss a story not of defeat, but of the remarkable human refusal to be simply defined by what has been lost. One final observation before we close. The fact that tooth loss is documented across the full arc of human history in hunter-gatherer skeletal remains, in agricultural populations, in ancient urban civilizations, makes it one of the most universal human experiences there is. Every human culture has had to reckon with it. Every human culture has developed some response to it. And the consistency of those responses across vastly different times and places, the astringent plants, the dietary adaptation, the efforts at replacement, the social accommodation suggests that these responses reflect something deeper than cultural invention. They reflect the operation of human ingenuity applied to a universal problem. You will lose teeth, or you already have. Someone you love will lose teeth. The experience connects you, whether you think about it this way or not, to an unbroken line of human beings doing exactly the same thing, managing the same loss, finding the same workarounds, feeling the same combination of frustration and adaptation and eventual acceptance. That continuity is not nothing. It is, in its quiet way, a form of company across time. The ancient person who packed their empty socket with crushed garlic and chewed their dried meat on the other side and kept going, they were doing what you would do, what you will do, what humans have always done. They lost a tooth, and then they kept living.